Taiwan is facing the biggest domestic outbreak since the pandemic began. Now, how serious is this outbreak? And is Taiwan containing it? Well, to give us some insight today is a top epidemiologist in Taiwan, Dr. Mei-shang, who is a professor at Taiwan's leading research institute, Academia Sinica. Dr. He, thank you so much for taking the time to speak with us today.
Hi, Natalie. Thank you for inviting.
Well, all of us here in Taiwan are very concerned about the recent spike in cases. Since May 15th, we've seen daily new confirmed COVID cases in the triple digits, roughly 200 to 400 cases a day. Can you tell us what these numbers signify?
It probably signifies that during the previous days, like the days before May the 15th, before we were very much aware of what was going on, probably we were very relaxing and there were lots of what I would call super spreading scenario or super spreading event. In such case, it would be lots of party, lots of interaction with people from all directions. And they have lots of physical contact. They were singing, dancing, etc. And these were all very sort of the situation scenario very conducive for explosive outbreak. All the cases we are seeing now, because we are now about 10 days down, since the sort of level 3 alert, and I believe most of what we are seeing were resulted from May 15th, before May 15th. So of course we have to continue to follow. After May 15th, what is the situation? I believe the transmission was not stopped totally, but I would say the transmission was dampened, hopefully, greatly. So if that was the case, we would see the onset symptoms occurring between May 23rd to May 28th, about these 5 days. We were seeing them continuously going down. And in order to see that, to be sure that we are not missing people who are still at home, we would have to follow the whole situation, probably 5 days onwards, say until June the 3rd or the 4th, so that we would be sure that the cases we are seeing are stable and would reflect whether our level 3 lockdown is effective, and whether we basically, and whether we are containing the situation or whether we are not.
So I've heard you say in some news reports that one confirmed case could represent another 9 or 10 unconfirmed cases hidden in society.
Definitely, for every case, there are still some out there, especially we have some odd 600 of those with no sources, because most of the cases that has been identified, they were able to link it to some situation, somebody they know, and pretty much could trace it back to the tea shop culture or tea shop ecology. But still there are some numbers of people that they are calling it cluster source unknown, and it's quite a few numbers. I calculated it was about 25% of all confirmed cases so far, so that will come up close to 1,000 now. So each one of these will represent probably a string, or I don't know how big of a string, at least some missing link to the source, and that would be something hidden in the society. But fortunately, there are some positive side about what's in our country, is that I think the situation may not be so grim. We still keep up the hope, because people seem to be very, very much voluntarily stay at home. We do much more than what the government asked us to do and earlier. So these are the given forces going to all directions. It's really difficult to project when we'll be able to contain it. We hope that we are containing it, at least the acute phase.
Do you think that the current measures, the level 3 measures, which is just short of a level 4, which is a full lockdown, are enough? Do you think that perhaps we should go under a full lockdown and contain it fully and then open up later?
No, I think at this moment we are so close to have the vaccine. We are not, it's like we are able to see the end of the tunnel. So we should hang on. If a full lockdown means total lockdown, nobody works. That would be too much of an impact psychologically and everything. We can look at the total figure of the confirmed cases on a daily basis, comparing it with our neighboring countries of the Asian countries. They have counting of 5,000, 6,000, and several countries are like that. And so I think that at this moment, we do the best we can. Those who have to work, continue to work. These are young and healthy people. And those who can stay home, stay home. The most important thing at this moment is to protect our elderly, protect our vulnerables. So we all know that not to visit them, to keep them, isolated and etc. Of course. And then the other thing would be keep our production line continue so that there's some sense of normalcy in this society, and everything else what's not essential to life pretty much is being shut down. Yeah.
So as we continue these current measures, and if the cases start going down a bit, how long do you think we need to be at level 3 before we contain the current outbreak?
It's difficult to say really contain. What we're saying is that we contain it to the level that the society, the medical, the healthcare facility system can tolerate. Basically, we are trying to balance, such. But to extend the level 3 for 2 more weeks is quite essential in such a way that, assuming there are still the number of asymptomatic cases as I projected, scattered around, it's better off if they can isolate themselves. They are isolating themselves, so they are not continue to spread. At the same time, it would allow time for them to reduce their infectivity, because we do know a person, once they just infected and the virus is rapidly replicating in their body, that's the viral level load is high. But if you wait another 10 to 14 days, usually it comes down. For all the data we have seen, that whether you have symptoms or you don't have symptoms, but once you come to the medical facility for us to diagnose you, we will see the viral load just goes downward. So we know pretty much a person who's symptomatic, at the time they present with symptoms, they reach pretty much the highest level. And asymptomatic people, we don't know, but probably follow the same course. They are exposed to the virus and follow the number of days, although we are unable to count them. But if they are quarantined for 14 days, their infectivity will go down, and that will reduce future problems in the community. Basically, that's the hope, and that's the rationale of what we are doing.
So asymptomatic people are contagious though, right?
At this moment, the scientific community estimates that about 50-60% of the cases are infected by pre-symptomatic and asymptomatic people. Pre-symptomatic are very important, yeah.
So right now we're using masks, and we also sometimes use dividers. Can you tell us how effective these measures are?
When we do the best we can, put on our facial masks, and we keep our hand hygiene and etc., we may not be able to completely be shielded off from the virus surrounding us, but our exposure dose would be sufficiently low enough that most of us probably would get asymptomatic infection.
Do you think that we need to be testing more people, or is the current method of contact tracing and just testing those who have contact history and symptoms is enough?
I've been often asked these questions, and I still calculated a little bit in my head. Right now, say we have 5,000 confirmed cases, and if say there are 5,000 outside, And of course, 5,000, they may spread a little more. So they are 10,000. And you can say, all these say you have 20,000 cases totally around in the city, and then you try to see whether you will be able to identify them. Say even in the metropolitan Taipei and New Taipei area, see the number is so low. This moment you try to identify them, it would be so laborious and take so much resources. And especially at this moment, we are all sort of staying at home. So, and also to test them with current sort of the way we are handling this epidemic, testing itself is medical care, is a healthcare behavior, basically. So it requires technical people, and it would also draw our healthcare resources. And as you know, you probably have heard that at this moment, we try to preserve our medical facility and human resources for, you know, the more severe cases. We try to get through this most difficult period. So we don't even think about sort of mass screening at this moment.
Dr. He, how anxious are you about the current situation?
I'm not really very anxious, actually. Because, you know, I'm an infectious disease doctor. We've seen a lot of this situation, and we know how to put the figures, although I know human are not figures, but still when you put in a public health contact, that you have to count the numbers and to know how extensive it is. When we put the figures in the perspective, it's really not very bad. It's still relatively low compared with all these other countries over 80 years old, over 60 years old, 70 years old. The death rate, we are far from the death rate that have been reporting. So the moment important thing is our healthcare capacity. That's the one thing. It's going to be the bottleneck of what we can do. So we do the best to try to preserve it.
News has it that Taiwan will be getting 2 million vaccines in June and a total of 10 million by August. Is that enough? And is that soon enough?
It's not enough. Of course, not enough. But one has to think of this. It takes time to administer this vaccine. And we are still yet to see how efficient, especially the 2 million doses are Moderna. And that's, you know, there's still some requirement is quite different from what the usual, you know, vaccine that I'm talking about, the transporting and storage condition in terms of temperature. So I'm yet to see how effective that our people can deliver the vaccine. Although previously we have been very good in doing this, but I don't know with these new variables in here, whether they are going to be doing it really well, doing it really smoothly. I don't know. So people has been saying that Moderna was, we had pre-procured 5 million doses, and now 2 million is coming in. But, you know, of course, 5 million cannot come in at the same time. So we kind of have to take time to digest it. It's not enough, of course, by August, but I don't know whether we'll really be able to administer 10 million doses in 1 month. So everything takes a little time. So it just gotta go on its course. And at the same time that we continue to keep it sort of, everyone lives in a semi-normal manner.
So it looks like Taiwan will have 3 different types of vaccines: AstraZeneca, Moderna, and our local vaccine. Can you tell us what you think of these vaccines? Will you be willing to take any of these vaccines yourself?
I would say this in a very careful manner, because I know whatever I say, people follow.
So that's right. You're an expert.
It's true. This morning, 2 days I went to buy some passion fruit, and they didn't have it. Second time I asked passion fruit, the guy says, "Oh, that's something we have to eat. So thank you for telling us." Oh my God, it's just something I like. So I have to be very careful about what I say. But basically, each vaccine has its strengths and disadvantages.
Do you have a preference for the type of vaccine that you would want to get?
I have to say, because I had participated in the vaccine trial, so I had been administered 2 doses of one of the 2 local vaccines.
Oh, okay.
The reason why, because they have been announcing again and again that they were there's a shortage of participants, subjects over 65 years of age. So I just gathered me and myself and with all my
You're not over
colleagues
65, are you?
Well, I'm over 65, so we kind
No,
of
I
help
can't
them.
believe that. You look
So
so
we just help them
young.
to get their numbers, basically that's the situation. Good or bad, you need to have numbers to know it's good or bad. And the earlier we know it's good or it's bad, the better off we are. So that's the situation. So with
You
no
look
presumption of whether it's good or bad, we just participate in it.
It's hard to believe you're over 65. You look so young.
Thank you. Thank you.
So would you suggest that people take whatever vaccine that's available to them? What are your suggestions in terms of vaccines?
Personally, if there is a choice, I would say the AZ vaccine, the younger female, should stay away from that if there's a choice, of course.
What does younger mean? What age is younger?
Different countries with different standard. I believe previously, I cannot match the country to the number, but it's like Germany and Switzerland or whatever, they were sitting at 60 or 65. And I know previously the Koreans set at 30. So, but there's no country. Well, one thing one must know that the concern is something called cerebral venous thrombosis, and that generally we know, for the reasons we don't know, but we know that the Asian population has a lower risk for acquiring such disease. So, but still we are very concerned about that. And even though the instance is like, it's like 1 million. If you administer 1 million doses, you may get 4. Is
that the blood clots that people have been talking about?
Yeah, that's the blood clots. Yes. And so younger female, try to stay away from that if possible. But at this moment, because of our shortage of vaccine and our government is not advising that, just administer, and so far seem to be no problem. We have no reported cases yet.
You're actually vaccinated then, right? You're fully vaccinated.
We don't know, because I may be in the placebo group, but I don't think I am. Because from my reaction, I have a little local reaction. I do know another person went with me. She had no reaction at all, none.
What was your reaction?
Just on the second dose, local site with swelling, hot, hard, a little pain,
And that, how long did that last?
3 days.
3 days.
Yeah, 3 days. I consider it's a really quite severe reaction, because it's hard and red. It's hard, red, hot, just on the arm side, that the administration side. But I think it's okay. I just stopped playing tennis, or I just let it rest for a few days. Yeah.
So how is your life now that we're under level 3 and you're also vaccinated? So how's life changed for you? Are you leading more or less a normal life because you're vaccinated, or?
Of course, everything, a lot of interview, a lot of conferences, a lot of meetings, we just, connected from home. But still, I go out quite a bit, because I get on the media and get on the televisions, etc. So, and also just we try to minimize any extra problems. So, like our colleagues in Academia Sinica, everyone's practice is that even though we come to work, we see each other, but we wave in distance, we just don't have social interaction, we just work, we don't eat together, etc. Just so, not so much that we are afraid that we will be contracted with the disease, but we are afraid we will be quarantined for 14 days, just if you are in contact.
That's more likely, right?
Yeah, that's more likely. So that's a situation that we try to not create all these problems, so we really with as little interaction as possible. Whatever you want to do, telephone call and telecommunication, etc., would serve the purpose.
So, how long do you think it will take before Taiwan can go back to normal?
Normal, I would say, until we fully vaccinated, about at least 50% of the people are vaccinated. So it would be quite some time, but hopefully we don't have to upgrade our level of alertness. Hopefully we are able to maintain what's essential and activity, and then to cut down just the leisure, the non-essential ones, we cut it out. So just tolerate a little bit, it will go away.
I think we're going to do okay in Taiwan. We've done so well during the whole year and a half, but all of a sudden this came out. So we're kind of, anxious here. Now the world is getting vaccinated. How long do you think it will take for the world to get back to normal?
For the major part of the Northern Hemisphere, we have to pass our winter, so that will be through next spring to be fully normal. But with US and Europe, they are opening up, so they're gonna just lead the way to some. So it just like I say, epidemic would go on its pace, but at a different pace at different place, and then everyone will be affected at different pace, but we are aiming towards the same direction, just sooner or later, depends on where you are.
Well, Dr. He, thank you so much for speaking with me. Are there any last words you would like to tell people in Taiwan and throughout the world as they continue to face the pandemic?
Well, I would like to say that just hang in there, keep healthy. A healthy body can prevent all diseases. So it's important, and how to keep healthy, especially now we are all staying at home. Still try to keep active, doing something, push up, whatever, and eat healthy. Don't binge away with sweets. It's important. It's really important. And if necessary, take some vitamin supplements so that keep your nutritional level at optimal level, etc. These are all very important, and just stay, in a good mood, and don't worry, knowing that we will pass. Of course, we will win the battle.
Well, Dr. He, it's been wonderful speaking with you. Thank you so much for sharing your expertise with us.
Thank you, Natalie. Thank you.
I've been speaking with Dr. He, a top epidemiologist here in Taiwan, about the current outbreak. Thank you so much, Dr. He.